Independent Community Pharmacy Business Plan 2025 Executive Summary. This comprehensive business plan outlines the development of a successful independent community pharmacy positioned to serve local healthcare needs while navigating the challenging landscape of 2025. Our pharmacy will differentiate itself through personalized patient care, comprehensive clinical services, and strong community engagement, targeting a total investment of $650,000 to establish operations in a strategically selected suburban location. The independent pharmacy sector faces significant challenges in 2025, with over 30% of independent pharmacies at risk of closure due to reimbursement pressures from pharmacy benefit managers, PBMs, and increased competition from chain pharmacies and online platforms. However, opportunities exist for well-positioned pharmacies that focus on clinical services, specialty care, and community health management. Our financial projections indicate break-even by month 18, with projected first-year revenues of $2.8 million and a net profit margin of 3.2% by year 2. The business model emphasizes prescription dispensing, 75% of revenue, over-the-counter products, 15%, clinical services, 7%, and specialty programs, 3%, providing multiple revenue streams to ensure financial stability. The pharmacy will serve a population of approximately 25,000 residents within a 3-mile radius, focusing on chronic disease management, preventive care services, and medication therapy management. Our target market includes insured patients aged 45, 75, families with chronic conditions, and underserved populations seeking accessible healthcare services. Our mission is to enhance community health by providing personalized pharmaceutical care, comprehensive medication management, and accessible clinical services that improve patient outcomes and quality of life. We are committed to being more than a prescription dispensary. We aim to be a trusted healthcare partner that addresses the complete wellness needs of our community. We will achieve this mission by offering medication therapy management, chronic disease monitoring, preventive health screenings, immunization services, and health education programs. Our pharmacy will serve as a healthcare hub where patients receive continuous coordinated care that bridges the gap between physician visits and daily health management. Business model and structure. Our independent community pharmacy will operate as a limited liability company, LLC, combining traditional prescription dispensing with expanded clinical services. The 2,800 square foot facility will house a modern dispensing area, private consultation rooms, a clinical testing area, and retail space for over-the-counter medications and health products. Location and facilities. The pharmacy will be strategically located in a high-visibility retail center with ample parking, adjacent to medical offices and senior living facilities. The location provides easy access for our target demographic while ensuring compliance with all state and federal accessibility requirements. Service portfolio. Primary services include prescription dispensing, medication synchronization programs, adherence packaging, compounding services for specialized medications, point-of-care testing, A1C cholesterol, blood pressure monitoring, immunizations for all FDA-approved vaccines, medication therapy management, and chronic care management programs for diabetes, hypertension, and cardiovascular conditions. Technology integration. The pharmacy will implement a comprehensive pharmacy management system with electronic health record integration, automated dispensing technology, telepharmacy capabilities for remote consultations, and a patient portal for prescription management and health tracking. Target market demographics. Our primary market consists of adults aged 45, 75 with chronic conditions requiring ongoing medication management, representing approximately 40% of the local population. Secondary markets include families with children requiring routine immunizations and health screenings, working professionals seeking convenient healthcare services, and seniors requiring specialized medication packaging and delivery services. Market size and potential. The local trade area encompasses 25,000 residents with a median household income of $68,000, significantly above the national average. Market research indicates 78% of residents have prescription insurance coverage, with Medicare and Medicare Advantage plans representing 32% of potential patients. Competitive landscape. The market includes 2 chain pharmacies, CVS and Walgreens, within 2 miles, 1 independent pharmacy 4 miles away, and increasing pressure from mail-order pharmacies. Our competitive advantage lies in personalized service, clinical expertise, rapid prescription turnaround, and comprehensive health services not available at chain competitors. Market trends and opportunities: growing demand for medication therapy management services, increased focus on preventive care, expansion of pharmacists' scope of practice in our state, rising prevalence of chronic diseases requiring ongoing management, and patient preference for local, personalized healthcare services create significant opportunities for independent pharmacies. Customer acquisition strategy. Initial marketing will focus on relationship building with local physicians, nurse practitioners, and specialists to establish referral networks. We will participate in community health fairs, offer free health screenings, and partner with senior centers and community organizations to demonstrate our value proposition. Digital marketing approach: a professional website with online prescription refill capabilities, targeted social media campaigns focusing on health education and community engagement, search engine optimization for local pharmacy searches, and email newsletters featuring health tips and pharmacy updates will establish our digital presence. Loyalty and retention programs. Implementation of a comprehensive loyalty program offering points for prescription fills, health screenings, and immunizations, with rewards including health products and prescription discounts. Monthly medication synchronization programs will improve adherence while increasing customer convenience and retention. Community engagement initiatives: regular participation in community health events, sponsorship of local sports teams and community activities, partnerships with schools for health education programs, and collaboration with local healthcare providers for comprehensive patient care will establish our pharmacy as an integral community healthcare resource. Leadership team. The pharmacy will be owned and operated by a licensed doctor of pharmacy, PharmD, with 8 years of clinical experience, including 3 years in independent pharmacy management. Additional management includes a part-time pharmacy manager with retail experience and administrative responsibilities for inventory and personnel management. Staffing structure. Initial staffing includes 1 full-time pharmacist, owner, 1 part-time pharmacist for coverage and clinical services, 2 certified pharmacy technicians for prescription processing and customer service, and 1 part-time administrative assistant for insurance processing and customer relations. Professional development. All staff will receive ongoing training in clinical services, customer service excellence, new pharmacy technologies, and regulatory compliance. The pharmacy will invest in continuing education programs to maintain certifications and expand service capabilities as regulations and opportunities evolve. Advisory Board. An advisory board consisting of a local physician, an experienced independent pharmacy owner, a healthcare attorney, and a community business leader will provide strategic guidance, regulatory insights, and business development support throughout the startup phase and ongoing operations. Workflow and process management. The pharmacy will implement standardized workflows for prescription processing, inventory management, clinical services, and customer service. Automated dispensing technology will improve accuracy and efficiency while reducing wait times for customers. Inventory management system. Implementation of a comprehensive inventory management system with automated reordering, real-time tracking, and integration with prescription processing software. Initial inventory investment of $85,000 will ensure adequate stock levels while minimizing carrying costs and expiration losses. Technology infrastructure. The pharmacy management system will integrate prescription processing, insurance billing, inventory management, and clinical documentation. Point-of-sale systems will handle over-the-counter sales, and telepharmacy capabilities will enable remote consultations and medication management services. Quality assurance protocols. Comprehensive quality assurance procedures include double verification of all prescriptions, regular accuracy audits, temperature monitoring for medications requiring refrigeration, and documentation of all clinical interventions to ensure patient safety and regulatory compliance. Initial capital requirements. Total startup investment of $650,000 includes pharmacy equipment and technology, $125,000. Initial inventory, $85,000. Leasehold improvements and renovation, $95,000. Professional fees and licensing, $25,000. Working capital for first 18 months, $225,000. Marketing and grand opening, $15,000. Insurance and bonds, $12,000. Furniture and fixtures, $18,000. security systems and monitoring $8,000, and contingency fund $37,000. Equipment and technology costs, pharmacy dispensing system and automated packaging equipment $65,000, point-of-care testing equipment for clinical services $12,000, computer systems and networking infrastructure $18,000, security cameras and alarm systems $8,000, refrigeration units for medications $7,000, and furniture for consultation areas and retail space $15,000. Facility and renovation costs, initial lease deposit and first 3 months rent $24,000, leasehold improvements including pharmacy renovation to meet regulatory requirements $65,000, flooring, lighting, and HVAC modifications $18,000, signage and exterior improvements $8,000, and utility deposits and setup costs $4,000. Professional services and licensing, legal fees for business formation, contracts and regulatory compliance $8,000, accounting setup and initial tax planning $4,000, pharmaceutical licensing and DEA registration $3,000, professional liability and general business insurance $8,000, and consultant fees for pharmacy design and workflow optimization $2,000. Revenue projections and financial forecasts. Best scenario, year 1. Revenue projections. Prescription sales are projected at $2,100,000, average 450 prescriptions per day at $13 average reimbursement. Over-the-counter sales at $420,000, clinical services including immunizations and testing at $196,000, and specialty services including compounding at $84,000, totaling $2,800,000 in first-year revenue. Operating expenses year 1. Cost of goods sold including prescription medications and OTC products, $1,890,000. Staff salaries and benefits including pharmacists and technicians, $285,000. Rent and utilities for 2,800 square foot facility, $72,000. Insurance including professional liability and general business coverage, $24,000. And marketing and professional development, $18,000. Profitability timeline. Monthly break-even is projected for month 18 with prescription volume reaching 425 daily prescriptions. Year 1 projects a net loss of $85,000 due to startup costs and customer acquisition expenses. Year 2 projects net profit of $89,600 with revenue growth to $3,150,000 and improved operational efficiency. Cash flow management. Monthly cash flow projections account for typical payment delays from insurance providers, average 21 days, and Medicare/Medicaid, average 28 days. A $225,000 working capital reserve will maintain operations during the critical first 18 months while building a customer base and establishing consistent revenue streams. Financial risk mitigation. Diversified revenue streams, including prescription dispensing, clinical services, and retail sales, reduce dependence on any single income source. Contracts with multiple insurance providers and pharmacy benefit managers minimize risk from single-payer reimbursement changes or network exclusions. Operational risk management. Comprehensive insurance coverage, including professional liability, general business, cyber liability, and business interruption insurance, protects against various operational risks. Backup systems for prescription processing and inventory management ensure continuity during technical failures. Regulatory compliance risks. Ongoing training programs for all staff ensure compliance with constantly evolving federal and state pharmacy regulations. Regular audits and documentation reviews minimize the risk of regulatory violations that could result in fines or license suspension. Market competition contingency. Development of unique service offerings, including specialized compounding, comprehensive medication therapy management, and partnerships with local healthcare providers, creates competitive differentiation that larger chains cannot easily replicate. Pharmacy management system. Implementation of a comprehensive pharmacy management system with real-time prescription processing, automated insurance billing, inventory tracking, and clinical documentation capabilities. Integration with electronic health records from local healthcare providers will improve patient care coordination and clinical outcomes. Automation and efficiency. Automated dispensing technology will improve prescription accuracy while reducing processing time and labor costs. Robotic systems for high-volume medications and automated packaging for adherence programs will enhance operational efficiency and patient safety. Digital health services, telepharmacy capabilities will enable remote medication consultations, adherence monitoring, and chronic disease management services. Mobile applications for prescription refill requests, medication reminders, and health tracking will improve patient engagement and convenience. Data analytics and reporting, advanced analytics software will track prescription trends, identify clinical intervention opportunities, monitor inventory turnover, and generate reports for regulatory compliance and business optimization decisions. Medication therapy. Management. Comprehensive medication reviews for patients with multiple chronic conditions, drug interaction screenings, adherence counseling, and coordination with prescribing physicians to optimize therapeutic outcomes. Insurance reimbursement for MTM services provides additional revenue while improving patient health outcomes. Preventive health services. Point-of-care testing for diabetes management, A1C, cardiovascular risk assessment, cholesterol panels, and routine health screenings. Immunization services for all FDA-approved vaccines, including COVID-19, influenza, shingles, and travel vaccines, generate additional revenue while serving community health needs. Chronic disease management programs, specialized programs for diabetes, hypertension, asthma, and cardiovascular disease management, including regular monitoring, medication adjustments in collaboration with physicians, and patient education to improve clinical outcomes and reduce healthcare costs. Specialty services, compounding services for customized medications not available commercially, including hormone replacement therapy, veterinary preparations, and pediatric formulations. These specialized services command higher margins while serving unique patient needs not met by chain competitors. Licensing and certification requirements. Maintenance of all required federal and state licenses, including DEA registration, state pharmacy license, and individual pharmacist licenses. Ongoing compliance with United States Pharmacopoeia (USP) standards for compounding and medication storage. Documentation and record-keeping, comprehensive documentation systems for all prescription dispensing, clinical interventions, adverse drug reactions, and patient counseling activities. Electronic record-keeping ensures compliance with state record retention requirements while facilitating efficient auditing and quality assurance reviews. Staff training and certification, regular training programs for all pharmacy staff on regulatory requirements, safety protocols, customer service standards, and new clinical services. Maintenance of professional certifications for pharmacists and technicians ensures compliance with state continuing education requirements. Quality control procedures. Implementation of multiple quality control checkpoints throughout the prescription dispensing process. Regular accuracy audits, temperature monitoring for refrigerated medications, and systematic review of all clinical interventions to ensure patient safety and regulatory compliance. Physician relationship development, systematic outreach to local physicians, nurse practitioners, and specialists to establish referral relationships and clinical collaboration opportunities. Regular visits to medical offices, participation in medical staff meetings, and provision of clinical pharmacy services will build professional relationships. Community health initiatives. Regular participation in community health fairs, free health screenings at senior centers and community events, educational seminars on medication safety and chronic disease management, and partnerships with local organizations to provide accessible healthcare services. Digital marketing strategy. Professional website with educational content, online prescription management capabilities, and patient testimonials. Social media marketing focusing on health education, community involvement, and pharmacy services will build brand awareness and customer engagement. Patient education programs. Monthly educational seminars on topics such as medication safety, diabetes management, heart health, and immunization schedules. These programs establish the pharmacy as a trusted health information source while attracting new customers and building loyalty among existing patients. Scenario planning, development of multiple business scenarios, including optimistic growth projections, conservative baseline expectations, and challenging market conditions. Financial models for each scenario ensure preparedness for various market conditions and enable proactive strategy adjustments. Emergency protocols. Comprehensive emergency procedures for natural disasters, Extended power outages, computer system failures, and staff emergencies ensure continuity of prescription services during critical situations. Backup systems and alternative service locations maintain patient access to essential medications. Financial contingencies, establishment of additional credit facilities beyond the initial working capital to address unexpected expenses or revenue shortfalls. Relationships with pharmacy-specialized lenders provide access to additional financing if market conditions require extended startup investment. Exit strategy options. Potential future opportunities include sale to another independent pharmacist, acquisition by a regional pharmacy chain, franchise affiliation with a national brand, or development into a multi-location operation. Maintaining detailed financial records and operational documentation ensures maximum value if a sale becomes necessary or advantageous. The independent community pharmacy market in 2025 presents both significant challenges and compelling opportunities for well-positioned operations. While PBM practices and chain pharmacy competition create headwinds, the growing demand for personalized healthcare services, expanded pharmacist scope of practice, and community-centered care create sustainable competitive advantages for independent pharmacies. Success requires careful attention to financial management, particularly during the critical first 18 months when customer acquisition and operational efficiency development are paramount. The projected investment of $650,000 provides adequate capitalization for a professional operation capable of serving community healthcare needs while achieving financial sustainability. Implementation will begin with securing financing from pharmacy-specialized lenders who understand the unique challenges and opportunities in independent pharmacy operations. Simultaneously, location finalization, licensing applications, and staff recruitment will commence to enable opening within 4-6 months of funding approval. The pharmacy's focus on clinical services, community engagement, and personalized patient care positions it for success in an evolving healthcare landscape where patients increasingly value accessible, comprehensive care from trusted local providers. With proper execution of this business plan, the pharmacy will become an integral part of the community healthcare infrastructure while providing sustainable returns for stakeholders.